everyone. This is Jen Mark with Buzzcast podcast for the Ontario Athletic Therapist Association. I am so excited to introduce Jennifer Johnson to you. Jennifer is an athletic therapist who operates the S.M.A.R.T Clinic for industrial athletes. Jennifer founded the S.M.A.R.T Clinic in 2003 and has since worked with various professional and amateur athletes, sports teams, and manufacturing industries in and around the GTA. Welcome, Jennifer.
Thank you. It's amazing to be here. I'm so excited.
That's great. Yeah, I think, we spoke a little bit before the interview, and I'm so excited about some of the concepts that you're going to be introducing us to. So explain a little bit to us about what an industrial athlete is.
Yeah, an industrial athlete is really as simple as what you think what an athlete would be. An industrial athlete is a worker that has the knowledge, the skills, the abilities to perform a job that's physically demanding that requires strength, flexibility, endurance, and coordination, which is what, as athletic therapists, we think of our athletes. And you or I couldn't just step in and do their job without being prepared for it. And it's the same mentality going into the workplace. I can't step in and do one of their jobs and think that I can do it without knowing and having the knowledge of how they move their body and how they work and being conditioned for it.
That's if you hadn't been explaining industrial athlete, you're right, you would have been explaining any sports athlete at the same time. So
exactly,
it's probably pretty much a forgotten area in terms of treatment and training, that kind of stuff.
Yeah, our mentality as athletic therapists to think about the cause and look at the movement and observe and assess, and then get into that sport specific phase of rehab. We just take that exact same mentality into the workplace with our industrial athletes. We have to use that sport specific mentality and look at what are they doing. So how can we make sure that they're prepared for the job, or if they do get injured, how can we condition them back to their job that they don't get injured again? Exactly what we do with our athletes.
What kind of industries would fall into this? Like, what kind of industry are you talking about here?
Really, you can have any industry that has that prolonged overuse, repetitive type movement. So we've worked with manufacturers, we've worked with transportation, food processing. We've recently started working with PSWs and cooks and maintenance workers. So really, we do office assessments as well. We go in and we give programs for in the office area. So it's really anything that you can think that you're doing a prolonged movement or repetitive or overuse. We consider an industrial athlete, and we will go in and help as much as we can.
Now, I know we talked about earlier about, and you said at the top of the podcast about how these industrial athletes could really be described the same way a sport athlete would be. Elaborate a little bit on what you do on the floor with the athletes, how you're observing and working.
This is something we've really started to amp up our services for, especially in the last 5 years. Ergonomics is a huge part of our treatment plan now. And athletic therapists are all about injury prevention and proactive care. And we really wanted to think how we could use our skills as athletic therapists and do that injury prevention so that we don't necessarily have to always be treating, but we can be out there. And when we think of as athletic therapists, when we're on the field, we're looking at the environment, we're looking at the equipment, we're looking at the individual themselves and trying to identify red flags to make sure that we can address those before the season starts or before the game starts, so that the environment's safe, the equipment's good for them to use, and that their body's conditioned. And so we took that same skill and put it on the floor at our manufacturing facilities. So we walk around the floor, we observe, we assess the movements, we look at the environment, we look at the tools that they're using. We even actually collaborate with some of the engineers and say, this tool is a great tool, but it's not ergonomically great for the workers. If you could tweak it a little bit this way or that way, it would help their body posture. It would help how many times they torque, how many times they do a specific action. So we really get to think outside that box and say, okay, let's make it safe for everybody on the floor using our AT skills in that aspect.
I love that. I love the preventative side. That's a love of mine is prevention. And I like how you're working right with the engineers on the tools. What has their reaction been to you being a part of the team?
Oh, it's great. I mean, everybody works together and enjoys the feedback because, individually, we all know our lane. We all know exactly what we're supposed to do and how we're supposed to help. But when you have an environment where you have the engineering part, you have the business part of the how you perform the process or the job that they're doing, and then you have the individual, and you put it all together, if everybody doesn't work together, we're not going to solve the problem. And again, as athletic therapists, we're always treat the cause, not the symptom. So that's how we're able to get to the root of the cause, that we don't have a cause to have symptoms. And that's when we work together.
I love that. And you're right. There's so much parallel. And I think talk to us a little bit about thinking outside the box as athletic therapists. You say we learn in school that, you're going to be working with a soccer player and you're going to do this in the gym. Talk to me a little bit about how you got into this.
Yeah, it wasn't anything that I, sought out when I graduated and thought, I'm going to work with the industrial athlete. But the more it was presented in front of me, the more I started to see how much it made sense. And through a common acquaintance, I knew that there was an occupational nurse that was looking for a physiotherapist to help with their workplace injuries. And I said, well, why wouldn't you talk to an athletic therapist? And so we went in, she says, yeah, sure, I'll meet with you. We went in, supposed to be a 15-minute meeting, and ended up being over 2 hours, where we just said, she said, here's my needs. And I said, here's how I can help. And by the end of it, we had a business plan where we could take this, start it at that facility. And then through that experience and through some interaction with the on-site doctor that worked there, I was able to say, this can be scalable. We can go into other places as well. And so it was definitely eye-opening to me in that meeting to see how much AT could help the needs of these workplaces. But I didn't realize it until I sat down and asked that one question: what do you need? And as soon as they started talking, I was like, AT can help with that. AT can help with that. And it's just kind of flowed from there.
I like how you said you went in and asked what they need and asked what the needs were. And don't we learn that in school too, right?
Yes. Yeah.
Now that was that you kind of got yourself into some big companies here. That was kind of where you started into. And what are the other sort of areas that you're into?
Yeah, I mean, right now we're really trying to push getting into the public health sectors, the regions, the counties, and looking into working with the PSWs and the nurses and the firefighters and the police officers, and trying to get into that area right now. And then really it's just going to other food processing places and saying, this is what we've done for this place. We can help here, and other manufacturers and other transportation areas. And as many times as we get that experience, I take it and I start going to every company I can think of and trying to show them we have proven facts and data that says we can help. And so we can help you as well. So I take one place, I get the experience, and then I try and push it to that same type of occupation.
So how has the employees' reaction been? How are they accepting of what your services are about athletic therapy?
They're really receptive. I mean, always when we start there, they're thinking, what's the alternative from the company? Because I think a shoe's going to drop. That it's so easy for us to come in and just help them. And I guess sometimes they're not used to a company being so open to just helping, and there not being another hidden agenda. But as soon as they come in, they're like, oh my God, I worked one day without pain. And the relief and the excitement in their voice is amazing. And then word of mouth just spreads. And before you know it, we're booked. And everybody's like, no, you guys should. We ask them, we do surveys, and we ask them what they need from us. And like, just longer appointments, be here more often and help us this. They really do. Like 99.9% of the individuals come in, and they're like our athletes. They come in, you get grumpy ones, you get motivated ones, you get ones that you have to push a little bit to do their exercises. So I mean, in that aspect, they're the same as our athletes. Lots of different personalities, and really fun to work with.
That's so fun. The more we talk about it, the more I can just see the parallels. And of course, my mind is kind of going, and you're right, all the different industries that could really benefit from the prevention, from the ergonomics. Do you do any different stuff like the strength, like with these companies incorporating the strength training, the preventative work? Is that part of what you do as well?
Yeah, we always have, as we call them, countermeasures. So part of our countermeasures is home exercise programs where we can do specific strengthening and stretching that was for that specific area that they work in. So we assess every area and then give a program to those areas. Obviously, if someone's injured or having pain, we specifically give them a program. But some of the places have a rec center, like a gym on site, that we're able to say, go do these ones at the gym, which has been great. They're new. We're hugely a part of the new hire program. So when we get new hires into the facilities, we're able to do an orientation. We're able to show them ways of moving, good stretches, good strengthening to start off before they even start their job itself.
That's very cool. I can remember when I did kinesiology forever ago, and them really talking about, workplace health and the prevention and the amount of money that companies spend on lost time and just the injury that happens maybe on site. So you guys must be helping big time.
Yeah, I mean, that's part of it. It's a win-win. It's the employees win because we're there to help them work pain-free. And when you're working pain-free, you're increasing their productivity, you're increasing their morale, you're helping with employee retention. But on the business side of it, you're saving them money. And that's what companies want. We reduce a lot of lost days and we save them a lot of money.
That's really awesome. Well, thank you so much, Jennifer, for your time today. Honestly, it's been such a great talk, and how we can expand our minds and step outside the box within this amazing profession of athletic therapy. Well, this is Jen Mark for Buzzcast Podcast for the Ontario Athletic Therapists Association. Have a great day, everyone.